How does a partial agonist work in pharmacology? Imagine a key that fits perfectly into a lock but only turns partway. That's similar to how a partial agonist interacts with receptors in your body. In pharmacology, drugs can bind to specific proteins called receptors on cells. These receptors act like switches that turn on certain responses when activated. Full agonists are like keys that turn the switch all the way on, producing the maximum response possible. Partial agonists, however, only turn the switch partway, leading to a response that's less than the maximum, even if all the receptors are occupied. To understand this better, think about receptor activation as a scale from 0 to 10. Full agonists push the response all the way to 10, while partial agonists only get it to around 5 or 6. When a partial agonist binds to a receptor, it causes a change in the receptor's shape, but not enough to fully activate it. This partial activation means the downstream signals inside the cell are weaker. Sometimes, partial agonists can even block the effects of full agonists. If both are present, the partial agonist competes for the receptor and prevents the full agonist from fully activating it. This is useful in medicine because it can reduce side effects by not overstimulating the receptor. For example, buprenorphine is a partial agonist at the mu-opioid receptor. It provides pain relief but with fewer risks of breathing problems or addiction compared to full opioid drugs. Another example is aripiprazole, which is used in mental health treatment. It acts as a partial dopamine receptor agonist, helping to balance brain chemicals in conditions like schizophrenia and bipolar disorder. In first and second year medical school, understanding how drugs like partial agonists work helps you see how medications can be tailored to produce the desired effect without overdoing it. It's all about controlling the response, not just turning it on or off. Knowing this makes it easier to grasp how different drugs can be used to treat various conditions safely and effectively. So, next time you hear about a drug that doesn't fully activate a receptor, remember it's probably a partial agonist, giving just enough stimulation to do its job without causing too many side effects.